caring for your own oral health is incredibly important, not only for your own self, but for the well-being of your child.
Welcome to Talking About Kids. I am your host, R. Bradley Snyder, researcher, activist, and author of The 5 Simple Truths of Raising Kids. February is National Children's Dental Health Month. To kick it off, I asked David Krol on the podcast to provide an overview of children's oral health. David is former chair of the American Academy of Pediatrics section on oral health, the lead author of the American Academy of Pediatrics clinical report, Maintaining and Improving the Oral Health of Young Children, and an eloquent and passionate advocate for children's oral health. In other words, the ideal Talking About Kids guest. Talking About Kids is sponsored in part by the Arizona Department of Health Services Must Stop Bullying campaign through its Title V Maternal and Child Health Program. For more information, go to muststopbullying.org. If you think the information in the episode might improve the oral health of kids in your life or your community, well then, please like this episode and then share the Talking About Kids podcast with your friends and colleagues. And now, the interview.
When I was in my pediatric training, even before I went into pediatric training, when I was in medical school, I knew that I wanted to do something on a larger scale for health. I was interested in taking care of the patient in front of me within the four walls of the office, but I was also really interested in having an impact on a large scale. And so when I decided to go into pediatrics, as I was finishing my residency career and then subsequently my fellowship, I started reaching out to folks who I thought might understand how to do this kind of work. I didn't know if it was going to be in a policy position or a government position or a foundation position or in private practice and just doing it on the side. So I talked to a lot of policy related people. And one of the people that I connected with was an individual who had done a health policy fellowship in Senator Tom Daschle's office. Senator Daschle was a senator a while back, I think from Wyoming, very powerful senator. Anyway, this pediatric dentist had done a fellowship in his office, focusing on health policy. And we were talking about my career goals, and he said, well, if you want to know everything that's wrong with our healthcare system, oral health and the oral health system is a microcosm of that. There's disparities, financing issues, workforce issues. We have a disease process that isn't being well controlled in certain populations. And as a pediatrician, if you decide academics is the way you want to go, you'll be one of a handful of pediatricians that know anything about oral health in any depth. So I thought, well, that sounds pretty neat. And so he was at Columbia University at the time, and he said, well, we have this oral health policy center at Columbia. Would you be interested in working part-time there and being a pediatrician the other part of the time? And I said, well, that sounds ideal. And so what I ended up doing is my first real job was at Columbia University in their School of Medicine in the Department of Pediatrics, being a pediatrician, a primary care pediatrician in Washington Heights, and then being a policy analyst and researcher in oral health in the dental school. And I had such a long title. I was appointed in the schools of medicine, dentistry, and public health. My title was so long; there had parentheses in it. But I loved it, and that's how I got connected because I was immersed in oral health. In fact, lots of people that I interacted with at that time, and even afterwards, even now, sometimes people think I'm a dentist because I live in that world, um, and I love it. And I do it now more on the side because my primary role is as the medical director of this clinically integrated network. But my passion has always been around children's oral health.
And, we've been using that term, or you've been using that term, oral health. And I have to say, for somebody that has worked with kids for, boy, for going on 3 decades now, I think that term, I've started to see it more and more over the last several years, and I think there's some real profound reasons behind that, where we just don't talk about caring for one's teeth, for example. So could you just, and I know this sounds like a dumb question, but can you tell me what is meant by oral health?
Sure, and it's not a dumb question. It because a lot of people don't fully understand what the term oral health entails. And so the first thing I think is really important to understand about oral health is that it's not just the absence of disease. And I
Mm.
had the wonderful opportunity to work with colleagues from the World Health Organization, world oral health experts from all over the world to come up with a definition of oral health. And I really love what we came up with. And geez, let me see if I can remember it. So it was something to the extent of oral health is a state of the mouth, the teeth, the oral structures that enables individuals to perform the essential functions of life, like eating
Mm.
and breathing and speaking. So it was more than just no disease. It was the ability to be fully present in life. And not only that, but it encompasses the psychosocial dimensions like self-confidence,
Yeah.
well-being, the ability to socialize and to work without pain in the case of children, to be in school, learn without pain, discomfort, and embarrassment. And now, I mean, think about that for a moment. It's pretty obvious that when you have a cavity and it can cause significant discomfort. And for those of you and who might be in your audience, you probably, hopefully, you've never had a cavity, but if you've had or any tooth pain, you know it can be pretty frustrating, if not
Right.
disabling. And imagine a child in school trying to learn, trying to develop, trying to interact and behave, pay attention in school, having a tooth decay and a cavity and a toothache. It can be hard, if not impossible, to be successful in that. And so, getting back to the definition, it's more than just the absence of disease. It's the ability to fully function in our society. That's really what oral health is.
Well, and you know, in your work, and I should mention, that you are the former chair of the American Academy of Pediatrics section on oral health, and
Yeah.
the lead author of the AAP's clinical report, maintaining and improving the oral health of young children. Indeed, it's that report that led me to you.
Oh, great.
But in addition to that tooth pain, which again, it can be at worst debilitating and at least distracting. What are some of the other things that happen to kids if their oral health is not maintained?
Well, beyond the anatomical issues that are associated with cavities, tooth decay, dental caries, and it's probably worth at some point in our conversation explaining those because there's a lot of
Yeah.
confusion about those terms. But um, outside of the anatomical, think about just the real estate around your face, right? So there's your mouth, but not too far away is your eyes. You can think about your brain. There's
Hmm.
possibility there. And if you've got abscesses, there's a horrible story about a child named Diamante Driver who unfortunately passed away because an untreated tooth abscess that the patient had, the infection had migrated to his brain and he had passed away. And this was in Maryland. And actually, it was a real uh, driver
Mm-hmm.
to improving children's oral health, both in that specific state, but also nationally, unfortunately for such a tragic thing. But so there's the real estate issue, the anatomical issue. But as I mentioned, it's the impact that oral disease can have on functioning in life, whether it's and for children, it's developing, it's learning, it's growing socially.
Mm.
Poor oral health can have an impact on all of that. I mean, when we think of school age and small children, it's about the ability to pay attention in school, the ability to sit still, the ability to be pain free and be successful. As a child gets older, as an adolescent, and even as an adult, the social impacts of oral health play a larger role because social interaction is so important for adolescents, even for adults. So, um, imagine you have decay or
Mm. Right.
discolored teeth or anything like that, and you're missing teeth, and you're trying to communicate, you're trying to build a relationship. As you get older, you're trying to get a job. It the way people react to you, they see you, and
Right.
right in the front there is your mouth and your smile.
Right.
And remember years ago when there used to be a spate of makeover shows, if you remember those on television, one of the first things people did is they got their teeth fixed,
Yeah.
quote unquote. And you could see what a huge difference that made, not only externally to the world, but also internally to the feelings of self worth for an individual. And I think that is why it's not just about the tooth or
Right.
the mouth. It's about so much more. And that's why I think that definition of oral health is really important, because it ties to that, and it clarifies the impacts that um, not focusing on or ignoring children's oral health can have on the life of a child.
And I do want to mention, I want to pull out something that you've written about in other publications as well, this notion of inflammation, too. And I think my listeners will be most familiar with the dangers of letting inflammation go on from discussions we've had on this channel about adverse childhood experiences. And so, that's another aspect too, right? That this is an inflammation that your body has to deal with, and it's kind of a system wide response, isn't it?
Absolutely, yes. Both tooth decay, dental caries,
Yeah.
but also less common in younger children. It gets more common as we get older, is periodontal disease or gum disease. Um, you can imagine there's such a large surface area that in your mouth that can be inflamed. That inflammation, as you said, is systemic, and if you have another chronic disease, whether it be
Mm.
diabetes or any other inflammatory disease, it can make it harder to manage those other diseases,
Oh,
especially when
interesting.
there's quite a bit of evidence that has come out in recent years, and this is less of an issue in children, more of an issue in adults. But for individuals with diabetes, um, when there is inflammation, no matter where it is in the body, and let's focus on the mouth for a moment, when there is inflammation in the body, it makes it more difficult to manage your diabetes. And so there is a lot of work being done in trying to address the oral health of individuals with diabetes to
Right.
manage their diabetes. Does that make sense?
Oh,
That management
100%.
of
And even,
inflammation can have a
yeah.
significant impact.
And again, on talking about kids, we're always looking at those upstream solutions. And so, I'm hearing that, and I know because, again, we've talked about this on this channel, and I know a lot of my listeners are worried about juvenile diabetes and the trajectory
Yes.
that things like childhood trauma put some of their kids on towards diabetes. So this is another reason why we need to focus on oral health. And I'm going to take you up on your offer of defining a couple of terms that we've already used: cavity, decay, caries. That last one being one that, fairly new to me as I was like trying to brush up on the literature for our conversation.
Sure, happy to do that. And I think this is really important and something that even medical professionals confuse about some of these terms. So here's the easiest way I think I can describe it. So a cavity is a hole, plain and simple.
Mm,
A cavity is a hole in a tooth. That cavity, that hole, is a consequence of a disease process that has run rampant or has not been managed. So,
okay.
that disease process we refer to as dental caries. You can also call it tooth decay. Um, here's so when the disease process, dental caries, is allowed to progress, uh, then ultimately a cavity can develop, a hole in a tooth can develop, and that's irreversible. Um,
Mm,
you, I mean, you have to fill that hole. You can't build that enamel back up;
right.
it's gone. Now, a corollary, and maybe a good way of understanding this, is if we go back to diabetes. Um, as you probably know, there's no such thing as a diabetes, right? It's
Right.
diabetes, it's a disease process. Just like there's no such thing as a carie. Dental caries is a disease process. So that's one thing that's a bit of a
Okay.
corollary. But when we think about diabetes, it's a disease process that, if left untreated, can lead to a lot of negative things, sometimes irreversible, like you might have to have a foot amputated or something like that if your disease,
Mm,
if your diabetes gets significantly out of control. But that can be preventable, right? Those consequences of diabetes, just like the consequences of dental caries, that cavity can be prevented if we're intervening, if we're managing the disease, even if we're preventing the disease. If we can identify and treat, it can lead to um, good oral health and not to something that's irreversible like a cavity. So I hope that's helpful. So helpful.
absolutely.
Cavities the whole, dental caries slash tooth decay is the disease process that leads to something like a cavity or potentially could lead to something like a cavity. Does that help?
Oh, very helpful. What strikes me about how you and your colleagues and really the whole dentistry field, in addition to the broader oral health field, how they've been approaching this is in a very preventative way, which is not something that we see in other areas of healthcare. Like too often, we're a little more reactive than we are preventative. But you've also mentioned before, and again, this was a big part of the AAP's, the American Academy of Pediatrics report, is these social determinants of children's oral health. Now, hopefully, again, longtime listeners know about social determinants of health because they apply to education, they apply to a whole bunch of other things, reading skills, high school graduation, bullying, even. But let's talk a little bit about the social determinants of children's oral health. So, my listeners kind of need to know what to look out for in the populations with which they're working.
Sure. So the good news, if you want to
Hmm.
call it that, is that many of the same social determinants of overall health are also social determinants of oral health.
Right.
So if we're addressing those social determinants of overall health, we can also have an impact on oral health. So that's important. And why is that? It's because oral health is integrally part of overall health.
Yeah.
So that's important for everyone to remember. So when it comes to social determinants of health, I like to think of it as the child level, the family level, and the community level. And that's, as a
Hmm.
pediatrician, that's how we think, because children exist within the family and within their community. And so
Yeah.
the impacts are important there. So child level, or I don't know that I'd necessarily consider those social determinants, those physical attributes, biological, genetic characteristics, health behaviors and practices, which can be impacted by social determinants. And I'll talk a little bit
Hmm.
about that. And then whether you have insurance for dental care or not is, not really a social determinant of health necessarily, although um, one might argue that the availability of dental insurance and the availability of dental providers can be for sure. But let's start on a family level. So
Okay.
definitely family culture, family function, family composition can have a significant impact. So from a family culture point of view, if the family has um, a mindset of oral health as something that's either secondary or I found this in with some of my colleagues who work in the Appalachian region of the United States, where it's well, we have soft teeth. It's going to happen anyway. Your teeth are
Mm,
going to fall out. It's just what happens. Um, and so that's important. Socioeconomic status is incredibly important for a
yeah.
variety of reasons. The ability to afford the hygiene products that one needs to care for oneself, um, the ability to afford listen, even dental insurance for folks like me, a pediatrician, um, doesn't pay all the bills for dental
No,
insurance. It's not like
no,
medical insurance, it's very
right.
different. So much has to come out of pocket. That can be a challenge for families who maybe make enough to not qualify for Medicaid, but not enough to have dental insurance from their employer or be able to pay the extra that it costs to uh, pay for dental care. So that's important. Safety in the family in the household is very
Mm,
important. So we're talking about dental decay, but there's so much else associated with oral health. Trauma is an important part of that,
yeah.
especially for children. Keeping one's house safe. That little toddler who's banging into everything and falling onto this and that and the other thing. Being very careful and safety is really important. The health behaviors, of course, are also important. And then on a community level, the social environment, social capital, just like for the social determinants of overall health, are incredibly important. Um, the whether this is more of a structural
Hmm.
determinant from a community level, and I know there is some conversation right now about this topic, but water fluoridation, whether your water is fluoridated in the community, can have a significant impact on children's oral health, especially from a equity and disparities
Yeah.
point of view. So if one can't, so let me take a step back. Dental caries is a multifactorial disease. It has a nutrition component, it has a bacterial component, it has a genetic component. Um, and if from a hygiene point of view, if you can't afford the things that you need to care for your hygiene, water fluoridation in the background helps. It's not the total answer,
Right.
but it can help. And a community that can't afford that or chooses not to do that can have an impact on the citizens of its cultures or the citizens of its community. So I think when we think about social determinants of oral health, so there's so much overlap in those Venn diagrams of
Yeah.
overall health that it's hard to tease them apart.
And I noticed in the report, if I'm not mistaken, too, that you broke out diet from other social
Oh yeah.
determinants of health. And my bias on this one, David, is that for young children, their diet is determined by their environment. They are not going out and purchasing their own food. They are eating what's available to them or modeling the dietary habits of their primary care providers. So, in that sense, I mean, and I know that, the recommendation avoiding the sugary foods and the sugary drinks. We've heard from other experts on this channel also, hard foods, don't not too long on soft foods because of dental and mandible strength and things like that. So I just want to point out, I think of that as a social determinant, even though I know it's on the dietary side. given how influenced our kids are by their environment.
You are absolutely right. Yeah, the quality of diet is absolutely impacted by socioeconomic status. It's also impacted by your geographic location,
Yeah,
right? I work in Hartford, Connecticut. I do not think there is a grocery store in Hartford, Connecticut.
yeah,
You have to go to West Hartford or somewhere else to get one. You might go to the local bodega or the corner store for food, but you're not going to be getting those healthiest of foods that are best for children's oral health or for my oral health for that matter. So you're absolutely right. The ability to access healthy foods um, is incredibly important, and that's absolutely a social driver of overall health as
right.
well as a social driver of children's health.
In addition to this societal problem we have of the disconnect, these we call them food deserts, don't we, where people don't have access to the healthiest kinds of foods. Is there anything else that you think, and it's okay if this is on an individual level, anything else that you see parents or caregivers getting wrong when it comes to children's oral health?
Yeah, well, I think there's two things, and I touched on one of them before, and it's the idea of there's nothing I can do
Mm,
as a parent or a caregiver. That either this it's preordained because I had bad teeth, or I'm in a different socioeconomic stratum than another person, and I'm just doomed to have poor oral health. I want to disabuse folks of that because I think there are a lot of things that parents and caregivers can do for children. You touched on one, diet, as best one can, uh, providing the healthiest of diets as possible. And I know that can be challenging in various communities. Hygiene, incredibly important, and starting that early so that becomes a habit, because healthy habits are incredibly important when it comes to children's oral health. As best one can, when they are available in your community, getting your child to a dental provider as early as possible when those first teeth erupt. So that first experience with the dental provider is a positive one.
right.
Um, I, I can't emphasize that enough, how important that is, and what a difference it makes to have a 8-month-old child go to the dentist's office. It is simply a checking and counting the
Right.
teeth, providing information. No one's coming up at you with a drill or anything scary. Um, Totally different experience than if that first visit is, we've got to fix this and we've got to fix this and we've got to fix this, and here comes the needle and the drill. Totally different and has an impact over time. I know people that are still scared of the dentist
Yeah.
because of experiences that they've had as children. I think that's incredibly important. And you also touched on another one that I think is really important, is being a role model for your child. Caring for your own oral health is incredibly important, not only for your own self, but for the well-being of your child. Giving that example, that oral health, that taking care of your teeth is important. I think that's one. The
Hmm.
disabusing people of the notion that there's nothing I can do. That's one that I think some parents and caregivers could get wrong. I think the other thing that's important for small children, especially, is that baby teeth don't matter.
Mm,
I want people to get that out of their mind. Um, for two main reasons. Uh, the probably most obvious one is that um, those baby teeth are place savers for what's coming next.
okay.
If they have to be pulled early, less space will be available for the next tooth that comes in. And then what you're doing is you're getting to a situation of crooked teeth and
Mm,
potentially orthodontia if one can even afford that. Um, so that's one, is the sort of anatomic importance of baby teeth. But the second is the habits that, as I touched on, the habits that we build in caring for baby teeth builds an environment within the mouth that can be sustained throughout the course of that child's life. So when they're an adult, they continue those habits, one, and two, an environment is maintained in the mouth, secondary to good hygiene, that there is not disease when that second round of teeth come through. And so I think those two things, there's nothing I can do, and baby teeth don't matter, are the two main things that I think parents and caregivers can get wrong, but can be easily be remedied.
I want to go back to that first one real quick because it I'm reminded of something that we know, for example, about trying to get parents involved in the education of their children. We know that for some parents, school doesn't feel safe. They didn't have a good experience, and so they either avoid being actively involved in the education of their kids, or in worst cases, and it's being reported by schools all over the country, it's adversarial. Even this attitude that they bring to their child's school. Is there anything being done in the oral health community to help welcome those young parents in that didn't have a good experience or haven't had one yet?
Yeah. Well, I'm not a dentist,
Right.
but I do know that my dental colleagues are trying to make the environment uh, much more comfortable,
Mm.
from not only the environment, but also no needle practices. There are many no needle practices out there that care for both adults and children. The techniques that pediatric dentists use, who are highly trained in the care of children, um, and and highly trained in behavioral modification.
Okay.
Listen, the skills that work for children in behavior modification and calming can also work for parents as well.
Yeah.
I've seen it work for parents who have had bad experiences when they were younger. They come into the dentist's office, they see this environment that's so very different than what they experienced when they were children. Um, the techniques that are used are different. Um, and they feel more comfortable. It doesn't work for everyone.
Right.
Sometimes the trauma is too great and needs more assistance in overcoming that. But there's been a lot of progress by my dental colleagues in trying to make that dental office, that dental environment, be more welcoming, be more open to those that may have some anxieties in the care of their teeth.
Is there anything else that you see working kind of on a societal level? Any other interventions or programs that you feel are really promising, that you like the kind of outcomes that they're seeing and their potential for improving children's oral health?
Yeah, there are quite a few, and I'll I already mentioned water fluoridation that I think
Hmm.
is incredibly important. I do think that there are states that are really working on trying to make sure that all children have not only coverage for dental care, but also access to dentists who accept that insurance coverage.
Mm,
Because the presence of insurance doesn't necessarily guarantee access to care, as maybe
right.
your audience is well aware of. Um, and so I know there are a lot of states in the country that are really working on trying to engage, especially for those patients who are insured by Medicaid, um, trying to engage providers to participate in the program, to take more patients per practice. That's, I think, incredibly important and occurring. I think there's a lot of interprofessional collaboration now around children's oral health. When I first started in this area, there was a worry that pediatricians were coming and they wanted to be dentists,
Hmm.
and that couldn't. And I had to make the case that it couldn't be farther from the truth. We don't want to cut teeth. the term cut teeth is the real key. We want to just make sure that we can do everything we can to keep children healthy, specifically in this case around oral health, before they get to you, because the dentist, because sometimes they don't get to you, the dentist, until they're 3 or 4 or 5 years old. And in fact, when I first started, it seems so long ago. We as the academy have what's called a periodicity schedule. It tells us what to do when a
Mm,
child's X years old, these kinds of things should be done. And so that periodicity schedule at one time said send the child to the dentist at age 3. Well, I know, and now your audience will know, the disease process of dental caries can start well before age 3. In fact,
yeah.
as soon as that first tooth erupts, that disease process can start. So by age 3, it's way too late. There's probably already a cavity for many kids. So even my own organization saw that and said, boy, we really need to get these kids sooner.
Right.
And all of our professional organizations agreed that no later than age 1, 6 months, 6 months from the eruption of the first tooth is the best time to get kids there for the first time. So that was a big change. And the communication between pediatricians and dentists has improved over time. What pediatricians can do has changed and the knowledge level has changed. I got maybe an hour's worth of oral health training in medical school. In fact, when I was talking to that person at Columbia who said, "Hey, why don't you come and work for us?" I said, "I don't know anything about the mouth. I'm a pediatrician. They didn't teach me anything." But he said, "Ah, you're a smart guy. You can figure this out." And anyway, um, that interprofessional collaboration and coordination, I think, is incredibly important because, again, we can't separate the mouth from the body. We
Right.
shouldn't artificially separate these two professions that are taking care of, the physical quote unquote health and the oral health of the child. Those things have to be connected in some way. I think that's been a significant improvement. There's still much work to be done. There's no doubt about that, but I think that's been good. I think the ability for pediatricians to apply fluoride varnish in the
Mm.
interim until children can get to the dentist is incredibly valuable. Um, I think those are some of the things that have happened over the course of my relatively short career in children's health that has been incredibly valuable.
A lot of my listeners are teachers, and obviously there are parents who are listening to, and people that work in after school programs and other agencies that serve kids. Anything else that they can do to kind of promote children's oral health?
Absolutely, and forgive me if I sound a little bit like a broken record at times, but I think first and foremost, it's to recognize how integral children's health, oral health is to their overall health. It's really easy for oral health to fall by the wayside. I mean, for those in the audience, think about the last time you flossed your teeth.
Yeah.
Um, but keeping it at top of mind, keeping it in our curricula as teachers or as early educators, um, making it part of it's what we do. I mean, there are very creative ways to integrate oral health concepts into all kinds of different subjects in school, and I think that's a really opportunity. But if we can do that, if we can keep that top of mind, we'll be more successful in maintaining the oral health and well-being of children. Second, I think supporting as citizens of a community, I think supporting public health approaches like water fluoridation can make a difference. Um, that's a second thing. The third is, as best we can in as many settings as we can, encourage uh, dental hygiene, starting early, brushing with fluoridated toothpaste, um, augmenting our nutrition education with the impact that it can have on oral health, advocating for access to healthy foods in our communities, I think is really important. Um, Getting kids connected early to a
Mm.
dentist, really important, whether it's through Head Start or from the family or even from the schools, there are sometimes mobile dental units that come to schools or school-based health centers that have dental services that we can get connected to. And then for not only parents but also teachers, any direct service providers for kids, being a good role model, a good oral health role model for kids is incredibly important. We again, overall, we should do our best to be good role models for the children in our families, in our communities, in our classrooms. But being a good role model for oral health in whatever way we can do that is incredibly important. Kids look up to this. I can't tell you. Well, I'll give you an example. I uh, I was seeing a patient, and she was maybe 5 years old or so, with her both her parents were in the office, and we were talking about all kinds of things, and we talked about oral health, and I said, do you brush your teeth? Oh yes, I brush my teeth. My mommy helps me. Great, that's wonderful. Mommy should definitely help you. Does mommy brush her teeth? And she sort of looked back at the parent and she said, well, I've never seen her brush her teeth, but I think she does. And I love the opportunity. It's one of the neat things about pediatrics. You have this opportunity to use the child to educate the whole family. Same thing with
Yeah.
seatbelts. I always have this same conversation with seatbelts. Are you wearing your seatbelts?
Yeah.
Did mommy and daddy wear their seatbelts?
Are
These
you
are the
wearing
kinds
your
of things.
helmet?
Yeah,
Are your
exactly right.
parents?
Riding your bicycle
Exactly.
helmet. Exactly,
Yep.
exactly. So the I think the getting back to that point about being a good role model is incredibly important. And I think if we can all be good role models for children's oral health, we'll be more successful in improving and at least maintaining the oral health of the children in our communities and in our families.
Well, David, I want to thank you for being a great role model
And
in the public health space. I was so excited to get to talk to you, and this has just been so incredibly enriching. And thank you for just being a great guest on Talking About Kids.
thanks. It's been my pleasure. I'm always willing to talk about this.
That was David Krol. More information about David is at talkingaboutkids.com. And when you do visit the Talking About Kids website, leave me a note. Let me know what you think. I would love to hear from you. The Talking About Kids theme song is by the Senators. For more of their music, go to thesenatorsmusic.com. And remember, kids are young goats and young humans, and the difference is that young goats are easier to manage.